I just want to say a personal word about each of them, and then they will be formally introduced. Um, the governor of the state of New York, Kathy Hochul, is here with us. I have known Kathy for more than 25 years, something like that, and have worked with her and watched her, and I'm so proud she is our governor, and I'm thrilled that she took time out of her intense campaign schedule to be with us. And then Cherie Blair, my friend for many years also. Um, as many of you know, a human rights lawyer, an advocate for women, the founder of a foundation that does so much to help women become economically self-sufficient. She's literally just come from the Queen's funeral, and as she told me backstage, she was done with wearing black, and so she's got a bright dress on to kind of get back into the swing of things. And then Olivia Walton, someone who is doing incredible work in Arkansas to expand opportunity in Northwest Arkansas to be part of rethinking how we're going to have more and smarter ways of giving people, particularly women, economic opportunities. And I could not be happier that she's here as well. So with that, I'm actually going to turn it over to the people who are really running the program. Thank you all.
Thank you so much for that generous introduction. And I have to say that it is such a privilege to be here at CGI after so many years. I would like to say that we are now coming out of before times, and those before times when we were in community are so important. I want to thank Secretary Clinton because she has reminded us the importance of community and uplifting incredible voices in a time that we need it. I have to say that she has been a mentor to me personally and to our organization, and to see so many people trying to figure out how to solve problems after such a difficult time globally coming out of the pandemic, and her constantly leading. And with that, I'd like to turn to our panel. You know, Governor, I'm going to start with you because what Secretary Clinton was saying was absolutely true. The importance of making sure that we have women leadership oftentimes is defined as slightly different than having a man at the helm. No offense, gentlemen, but I'm sure you've heard it before. But you inherited a state that was coming out of a global crisis. And oftentimes that was centered around this idea of essential workers. And the essential workers were often women. And I was having this conversation with Tammy saying, you know, that word, that term, essential worker, always struck me as inequity in itself, because essential for who? And it was oftentimes women who had to go out into the workforce and come back and take care of multi-generational families. And I want to ask you, as you're seeing us reemerge, how are we taking care of this essential worker who is essential for so many of us?
Yeah, Maureen, thank you. That's an excellent question. I just want to say to Secretary Clinton, thank you for making New York City feel normal again, bringing CGI, all the traffic out there. We feel like we're back to normal. So and our panelists too. I'm looking forward to a conversation. What does coming out of a pandemic look and feel like? You're absolutely right. I took over as governor last August. So we were just coming through what we thought was the end of the pandemic, and then all of a sudden Omicron hit. So we were hit hard once again, and we had to manage that. But what the state needed at the time was someone to just calm everything down and to let them know that there was competent leadership without a lot of drama. And I saw immediately, and during the pandemic, I wrote an op-ed literally 2 weeks after the shutdown. They said, this could be a generational setback for women. Because as you pointed out, Maria, who are the people that were on the early morning dawn subways to go into their offices in the hospital and suit up and walk into the patients' rooms and keep them alive? Who are the people who had to sit at the kitchen table trying to make sure their own kids got an education while they're teaching a class of kids remotely, most of whom did not even have proper digital access? Those were the women again. They're the ones who were out there, you know, packing up the food in restaurants that people drove up to and picked up in the back. They were so exposed, and it took a toll. It took a toll, and I saw that with my first budget. I put $10 billion behind lifting up the battered down healthcare system, and within that, I did over $1.2 billion of health care bonuses for those women. We just gave out over $3,000 to say to these women, we know what you went through. Our healthcare workers went through hell and back. So it's part of it saying, I'm not just giving you, saying we owe you that debt of gratitude. I'm putting money behind it. And that's what I feel we owe the individuals of this state who stepped up and got us through this. But it also put a searing spotlight on the inequities, the injustices of that. Why were so many women in these entry-level, low-wage jobs and still trying to take care of their kids? That was a call to action. I have now called for a study to say what happened to women during the pandemic. I just announced it on Women Pay Equity Day, which we talk about every year. We're not quite there. Hope it happens in my lifetime, but we're focusing on that. But also I said we need to get the data, the numbers, and say, what were our vulnerable areas? How do we make sure that women are no longer the ones that have to be the essential workers for everybody else, exposing themselves, exposing their families? So it's also just a recognition of what they went through. And I would say we recognize it here in New York, the epicenter of the pandemic, and I say never, ever again.
And one of the ways we do that is through prevention. So, Tammy, I want to ask you, you have this incredible entrepreneurial vision, and you created Life Bank. And for those who are not familiar, Life Bank basically provides on a motorcycle blood to women who are giving birth in Nigeria, and actually saves them. And you've actually been able to demonstrate that just those couple pints of blood is revolutionary. Yet, when one of the things that Senator Clinton said today was that the life expectancy of maternal health here in the United States, everywhere else going up, it's going down, particularly among Black women, Native American women, Latinas. Can you talk about what we can learn perhaps from your work in Nigeria and apply it here to the United States, if anything at all?
Right. Thank you so much. I'm so glad to be here today. So there are about 5.4 million maternal death, preventable maternal death every year globally. Many of these deaths occur in the global south, developing countries, countries that have not built the health system to really save women. So the work that we do is to build that infrastructure using technology and using actually physical delivery infrastructure to get the supplies that are needed to save a woman's life to the hospital. So we're talking about uterotonics, we're talking about blood, and even oxygen during the pandemic. We were able to expand to oxygen and PPE, getting that to the hospitals in 3 countries in Africa. To your question about, as a woman who is Nigerian American, I care about, maternal health in both countries, right? And when we look at Black women and Latina women rather, and Native American women, like you said, that number is going up, but it's for different, very, very different reason. The U.S. health system is already developed, right? No one needs to build like a blood delivery system, delivering to hospitals where these women deliver. I think one of the things that's missing is the will, right? The will to solve the social determinants of healthcare, the will to ensure that we're reducing poverty in these particular communities, the will to ensure that women are insured appropriately. I have had to sort of like, while pregnant, deal with the American health system, and it's a lot, right? Particularly the insurance system. So for me, I think it is the will that is missing in this country to really invest deeply in the health of women, to honor women who bring life into the world, and to build the right system and to do the right work to ensure that women have access to the healthcare they need in the, one of the most developed countries in the world.
That's absolutely right. And, oftentimes people say that all this stuff is really hard. And then you pointed out, but the world came together to actually come up with a vaccine for a global pandemic. It didn't take years. It took close to 18 months. And so where there is a will of human ingenuity, there's a way. And with that, I want to bring in Olivia into the conversation, because one of the things that you're doing extraordinarily well is what's happening in Arkansas in the Heartland. I had the privilege to meet Olivia at the Heartland Summit in Arkansas, and how eye-opening of when there's intentionality, when there is will, when it is private civil society and government sectors coming together, that you can change industry and you can change people's lives. Can you talk a little bit about that? Like, what have you learned that we could apply at a different scale?
Well, first, thank you, Maria Teresa, and thank you, Secretary Clinton, for the opportunity to be here. It's really an honor for me to be up here with all three of you women who I admire so much. And I can't start without saying, yes, it's a developed country, but in Arkansas, in Mississippi, particularly in the delta between the two states, maternal health outcomes, infant mortality are those of a very low-income country, and it's really happening right here in America. Ingeborg Investments is just one of the work streams, and this is a very for-profit work stream. We do lots of things to increase access to opportunity in the middle of the country, right? Because we have this deep belief that a lot of the political divisions and a lot of the great challenges of our time come from a dearth of opportunity, and opportunity really being determined by the zip code you're born into, right? So let's help spread access to opportunity. Ingeborg tries to do that by creating more ways for women to build and manage their own money, okay? Because, you know, we talk a lot about gender equity. Well, let's talk about equity. Equity is a synonym for financial capital. So if you want women to have more power, let's help more women build and control their own finances. And there, the state is actually dire as well. Of all the money that goes into venture capital in this country, the tens of just 2% still, and it's a sticky number, just 2% goes to female founders and female startups. 15% of all general partners at VC funds in America are women. We have a long road to go, but I'm happy to say there has been a lot of progress.
That's wonderful. And so with that, it's this understanding that we need to invest more in women in capital. I often have a conversation, I run a nonprofit, and that, first of all, is a misnomer, as everyone knows. But there is a conversation that I have with the former president of Emily's List, Stephanie Shiriak, and she and I would grab coffee and say, you know, there is a pink tax when it comes to walking in, whether it's trying to find capital for your new business, or a pink tax when it is to trying to actually get your own organization up and running. Temi, can you talk a little bit about that and what you've had to experience in creating your own organization that is literally saving lives every day?
Right. So I think first, there is a misnomer, particularly for women. I'm going to answer this question from the global South and perspective. So there is often this idea that we must empower African women and women from the global South. Well, I'm here to announce that they are already pretty empowered, right? Number one, second, and third countries with the highest female entrepreneurs in the world are all African countries. So African women generally are participating in economic development, right? What they are not doing is building wealth, right? So scaling these companies, getting them to be larger, and ensuring that they can scale to different parts of the world. To Olivia's point, around 2% of VC goes to women. But when you drill down into what kind of women, black women get 0.0006% of all venture capital funds in the world. 0.0006%. So that is really, really significant. That is what is sort of like keeping these companies from growing, from scaling, and from being basically household names. When I look at my story of how I got into this room, it is really people looking past how I am presented, you know, a woman with darker skin color, a mom, visibly pregnant woman, you know, people looking, we've been looking past all of those things and say, okay, there's something here, right? She's already started, she's already shown what she can do. And foundations like Skoll Foundation, organizations like MSD for mothers and Merck for mothers, rather, really, you know, looking at me and backing me and saying, we like what you're doing, we're gonna back you, we're gonna invest in the work you're doing so that you can scale. And that's how we went from just a tiny little startup in Lagos, Nigeria, to being completely pan-Nigerian, to expanding to Kenya, and to expanding to Ethiopia, doing this important work.
That's amazing. And you know, I think what's really important to highlight is the fact that women, and particularly women of color, don't have that same access to capital. To give you an example of how unprepared we are for the future born, my daughter is 10 years old. She is in 5th grade. She is part of the Alpha generation, and she's the first technical generation, technically, of majority minority America. So if we look at the classroom today, and then look at women CEOs and women in governorships, it's not equity at all because we are not prepared. So what, Governor, would you like to see coming out of the pandemic? I mean, there's incredible ingenuity that's coming out of the pandemic of public-private partnerships. What should be the moonshot for us to invest in capital in women? And Olivia, I'm going to ask you the same question because I do think that it has to be an intersectional commitment. What would you like to see?
I walk into so many boardrooms, construction sites, tech seminars, clean energy seminars in my first art. And where are the women? Are they all in the ladies' room right now? Because this doesn't look normal to me. And that's, and in politics, my God, we're so high-fiving that there's 9 women governors in the United States of America. So, okay, progress has been made. But as the first woman governor of the state of New York in its entire history, we were one of the first colonies, we still have a way to go. So it's all about intentionality as well, and we talk about our investments. I was just at the opening of Terminal 1 out at not the opening, the groundbreaking for I go to so many of these things. There's either a pair of scissors or a shovel, I assure you. So, and I always am happier when it's a pair of scissors. But we said with a project of this scale, at JFK, surrounded by the borough of Queens, one of the hardest hit impoverished counties, boroughs, and they were the hardest hit by the pandemic, by the way. We need to make sure that the women and minority-owned businesses in this neighborhood have a shot. We achieved 30% MWBE goals. It's billions of dollars that are going to be state, federal partnership, private partnership going out to support not just the major contractor, but the supply chain, giving more people a shot at it. But they don't always know what to do. So I have my team saying, okay, we're going to help you get that seed capital. Here's a bridge loan so you can make your first payroll, because I know how hard that is. I'm joined by my sister who started tech business way before there were any women in tech, and it was always about you're going to mortgage the house and make payroll. I mean, that's how tough it was, and I don't think it's gotten a lot better. So you talked about intentional decisions. I made a decision. As the governor of New York, the first woman, I said, I'm going to surround myself with the smartest women in the state of New York, and I found them, and some are in this room, and I'm really proud of them. My senior team is all women, and they know. The marching orders are go out and find every way you can help women businesses, but also women in the workplace, and I know we'll talk some more about this, but running out of time. Childcare, childcare, childcare. I've been saying if we're going to give projects with state taxpayer funding, you have to come to me, Mr. Business, looking to start up and get some help. Tell me your child care plan. How does that work? You want to build 100,000 square feet. How much are you putting to build a child care center here? And they have to answer that question of me and my team now, because we're saying that is the barrier for women. That is why they're still not back to work. They need help. This is not one family's problem anymore. It's a beautiful gift to have children. But it's also an economic problem when I still have millions of women not back to work because of not having childcare. So all of a sudden, the big CEOs are paying attention to me saying, yeah, maybe you should have a childcare facility in your chip fab and stop asking why no women work for you, okay? So there's an easy way to do this. There is an easy way to do this.
Well, and I think what you're also alluding to is it's not just that it is nice to have women there, it's that it's an economic imperative, Olivia. And so talk a little bit about the importance of, I think we're used to making incremental progress and being satisfied with it. But because we have close to over 51% of women who are eligible to be in the workforce and many are sitting it out, what can we do as an economic imperative of why women need to be at the table? In many ways, running everything.
I couldn't agree more. No, I think we need to get the word out that the business case is already there. And we also need to get more women in a position to be writing checks, because we know that when women are writing checks, they are 3 times more likely to invest in other women. So as for the business case, I'm sure a lot of you know these things. There are lots of studies that show that female-founded startups are actually more profitable. They grow faster. There are lots of surveys that show that women are more empathic and in many ways effective leaders. I'll give you one statistic. According to BCG, for every dollar that a female firm raises, they generate 78 cents in revenue compared to a man who's generating 31 cents in revenue. So we're literally generating more than twice as much revenue. The business case is there. Get the word out. Beyond that, I would say we need to do we need affordable childcare options, of course. That is so critical to all of this. And then we need more innovation and solutions from both the public and the private sector. You know, I believe strongly in on-ramps to return to work, because for some people the right choice is to take a pause during those child-rearing years. And so we need ways for women to get back into the workforce, and we just need a lot more solutions for women to access capital and to control their own money. So another thing I like to say is tell the women in your lives to take control of their own finances.
So I think that's fantastic advice. I think that one of the things that folks don't realize oftentimes is that the reason women are in abusive relationships is it's economic. There's little option. In this idea, there is a liberation when you are able to control your destiny as a result. Very quickly, we only have a minute and 30 seconds. What is the one thing that we can walk out of here saying, coming out of the pandemic, this is the opportunity I see? I'll start with you, Olivia.
Invest in women, it's smart business.
Same.
I didn't have this up. Anyway, Governor.
And take care of the kids. That you take care of the children. There's no stopping the parents. My son right now is on 4 months paternity leave. His wife just did her 4 months, and so there is equal division of labor. That's the generation that I was not raised in. I had to put my career on pause because I couldn't find childcare back when I worked in Washington many years ago. So we're seeing progress, but it has to be intentional. Employers and partnership with government have to do something aggressive. We put $7 billion invested in childcare. Over half the children in the state of New York are eligible for childcare subsidies, and we're opening hundreds more. So I think that is still an economic barrier, because when we have all women who want to work back in the workplace, there's no stopping us. And I think that's the key to our success here in the state of New York as well.
And I think to underscore that, one of the things that you mentioned is that voting does work, because the reason that we're facing this opportunity is that President Biden actually passed one of the biggest packages that alleviated over 50% of children out of poverty overnight. That's intentional. Thank you so much, ladies, for the inspiration. Thank you.